Okay, so I just wanted to take a few minutes to go over the movement assessment, and the reason why I'm taking some time to do this is that it illustrates some of the bigger points. When you eventually end up taking KIN 236 functional anatomy, we will be applying this on a regular basis, but we're only going to be doing this for this unit, and then we're going to be moving on into the physiology. So this is really meant to be the introduction for it. The concept here is the concentric versus eccentric, as well as the joint actions and planes of motion. So what you're expected to do, and you see my screen here, is we have some examples here. Some of these exercises are straight from your movement assessment. Some of them are new, but you're doing one thing. The first thing you're doing is identifying the joint action that you're observing, and that joint action that you're observing is starting from this anatomical position, right? Everything starts from this erect, palms facing forward, arms and legs down by the side, head straight ahead. And you can see that from a lateral view, from an anterior view, and a posterior view. From here, you have 7 joints that we're really dealing with: shoulder, elbow, wrist, knee, ankle, hip, and then trunk and spine, right? So 6, but that's an over exaggeration of that. From this, though, from these images that are in your Blackboard shell, is that we're doing all of the joint actions, everything you can do in the sagittal plane: ankle dorsiflexion, plantar flexion, knee extension, hip flexion, hip extension, trunk flexion, extension, so forth. This is everything you can do in the frontal plane: ab and abduction, lateral flexion, and then everything you can do in the transverse plane: internal, external rotation, wrist supination, pronation, internal, external shoulder rotation, horizontal adduction, horizontal abduction, and so forth. These are the joint actions for the 3 planes, 1, 2, and 3. And what you see is always what you get. And the first part of this is being able to observe, when you're looking at an exercise like this, what joint action happened from here, your start position, to your end position. How do we classify that? The next step of this is going to be determine whether this is a concentric, eccentric, or isometric contraction. Right? That's our next phase, and this is where it can be a 50-50. Right? Actually, one of 3. It can be a third, a third, a third, based on what you're seeing in the movement occurring. Just because you see a joint action doesn't mean that's the muscle that's participating. That's where most of you got things incorrect in the movement assessment, is that you automatically want to tie, when you are seeing someone doing hip flexion or knee flexion or ankle dorsiflexion or elbow extension, you assume that automatically it's the muscle that is the muscles of extension, the muscle extensors or the elbow extensors are doing the job, and that's not correct. Okay. If you were taking a regular anatomy class from anatomical position, every movement from this position, almost every movement, is concentric, and the joint action and the muscle participation would be exactly the same. So when you're going through this, the very first thing you need to do is identify the joint motion, right? And that is what you see. So sometimes, like in this example right here, it might not be immediately apparent. We're used to being from this anatomical position. So if someone was produced hip flexion, you would be lifting your knee up to your chest, like you're seeing here. So that's the femur moving relative to the torso. That is not the case here. This is the torso moving relative to the femur. This is also hip flexion. So hip flexion, or the joint action, might present in different ways. So there's a couple tricky things here, like doing that. But once you kind of get used to that, it becomes not so confusing. And basically, the angle here, the hip the femur and the torso are coming closer together. You're seeing the same thing there: hip flexion, hip flexion. So there might be multiple ways of representing the same joint action. The other thing that throws some people off is this horizontal ab and abduction. So transverse plane motion, here's shoulder external rotation, there's shoulder internal rotation. This is horizontal abduction, which is basically flexion happening in the transverse plane, right? And this is horizontal adduction. This is flexion happening in the transverse plane. This is horizontal abduction, which is basically extension happening in the transverse plane. So what I mean by that, let's see if I can keep my screen there. is this is shoulder extension. This is happening in the sagittal plane. This is shoulder flexion. This is happening in the sagittal plane, shoulder flexion, extension, back to neutral, back to anatomical, extension, flexion. So here's shoulder flexion, here's shoulder extension, flexion, extension. Now, if I face you and I do shoulder flexion and extension, and I start to raise my hand up to the side, now this is shoulder flexion coming forward, flexion coming forward, horizontal adduction, horizontal abduction, horizontal adduction, horizontal abduction. They call it horizontal ab and abduction in most books. The better terminology for it really would be horizontal flexion, horizontal extension would make more sense. But this motion here, where I'm coming across like I'm coming in to give you a hug, horizontal adduction, is not internal rotation. Shoulder internal rotation happens along the axis of the arm, like through the long axis of the bone. So internal, external rotation. Those are the two things that students mostly get confused, is the the horizontal ab and abduction and the internal, external rotation. So after you identify the joint range of motion, the next thing you need to determine is the movement overcoming gravity, or is the movement going in the same direction as gravity? Gravity is always down, never changes, right? So if you're performing a movement and the resistance, so if there's no weight, so here, body weight is the resistance. If there is a weight, obviously the weight is the resistance. And gravity is having its effect on that mass, whether it's the body mass itself or the dumbbell or the weight or whatever the object is. If gravity is down and that movement is overcoming gravity, it's a concentric activity. So the joint action that you're seeing is being performed by the same musculature. So if you're seeing hip extension or knee extension, like you're seeing here, hip extension, knee extension, it's the hip extensors, knee extensors that are doing the work. Here, I'm seeing, I'm at an elbow flexed position and I'm going further into elbow flexion. So the joint action that I'm seeing here is elbow flexion. Gravity is trying to pull that water bottle down, which means that it's a concentric activity of the elbow flexors. So what you see is what you get. If, however, the movement you're observing is eccentric, meaning that it's going down with gravity, right now gravity is trying to pull him into this position, from a standing position to a sitting position. He's actually trying to pull him very quickly into this position, so much where he's trying to crash his butt right into the floor. He's not falling, he's not crashing, he's descending in control. He doesn't need, so what you see here is hip flexion, knee flexion, ankle dorsiflexion. He doesn't need any additional muscle force to pull him into that position. Gravity's already doing that. He's actually trying to slow that down. So his hip flexors and knee flexors are totally off. They're not even on. The reason why he's not crashing to the ground is because his hip extensors, knee extensors are slowing him down to the point where he'll get to a point where he's hovering. The same muscles that accelerate me up against gravity are the same muscles that are going to slow me down against gravity. So here you see hip flexion going into, you see hip extension, right? Hip flexion, hip flex position to a hip extended position. And it's the hip extensors that are doing the work. Here you see hip extended, hip flexion, you see a hip flexed position. It's still the hip extensors doing the work. It's the hip extensors here working concentrically, hip extensors here working eccentrically. The muscles here were shortening. That's what these arrows are depicting here. The muscles here are lengthening. That's what those arrows are depicting there. Same thing here. I'm going from a elbow flex position to a more flexed position. That's a shortening of the muscles. Muscles are overcoming gravity. Here, gravity is winning the tug of war, so it's pulling the water bottle down, but it's doing it slowly. It's not just dropping it like gravity wants to. It's moving slowly, so that's the eccentric contraction. So that's the big thing that you have to look at there. Oops. So if the joint action is going in the opposite direction of what gravity is trying to do, that's a concentric contraction. The joint action, the same muscles here, they are elbow. You're seeing the joint action, elbow flexion. The elbow flexors are doing the work. Eccentric contraction, the opposite muscles are doing the work. You're seeing elbow extension. So here's a flex, here's an elbow flex. I'm going away from flexion into extension. I'm seeing elbow extension, but it's not the extensors that are working. It's the flexors that are working to slow that down. And then if I see no change, right, here's my starting position, there's my end position. It's an isometric. These, the concentric and isometric, are basically the same in terms of the analysis, right? This is just the same muscles, just this is resulting in movement. This is resulting in no movement, but it's still overcoming gravity. So that's the big takeaway from the steps in this process. So if I go through and I do some of these examples here, here's a pull-up. You can see it's a wider grip, so it's coming down to the side here. So this could be argued either way, whether this is shoulder flexion, extension, or horizontal ab and abduction. But let's say that what we're seeing here, because the arm's coming overhead back, this is a arm over the head. So arm going forward, that's flexion. Arm coming back down to the side, that's extension. So what we're seeing here is shoulder extension. You could also argue that this is horizontal adduction. I have this as an example and not in the movement assessment because of the dual interpretation. The elbow can only do one thing. You can see that the arm is straight. So I'm going from an extended position to a flexed position. Here he is hanging down from the bar. He's over the bar. Gravity is down. This is clearly a concentric phase. So this is shoulder extension, elbow flexion happening concentrically by the shoulder extensors, elbow flexors. Here is our toe touch position. We started from anatomical from this position here, and we're reaching down to touch our toes. So we went from a standing position to a bent over position. Gravity is pulling us down. This was done by gravity, not by muscle contraction. So what I see here is I see slight knee flexion, I see hip flexion, I see trunk flexion, I see shoulder flexion, and I see elbow flexion. So I see flexion through the entire kinetic chain. Since gravity was doing the work here, since I moved down in the same direction of gravity, and she didn't smash her head against the ground, right? Unless the movement depicts that it's saying that it was done explosive or as fast as you can. It's not. It's in a controlled motion, right? Because if she went down as fast as she can, yeah, she probably wouldn't hit her head, but she'd do a somersault. The muscles that are contracting here that slowed her down are the same muscles that would contract to bring her back up. So if I were to ask you the question, which muscles are involved to stand back up, you would say hip extensors, trunk extensors, shoulder extensors, and so forth, right? You would say extension to pull yourself up. So those are the muscles that are used to control, that were active on the way down because they were under control because it was an eccentric phase. So it would be my hip extensors, knee extensors, trunk extensors, and so forth, okay? So it's the opposite joint action of what we saw because this activity is an eccentric activity. Same thing here with the squat. It's asking you about the ankle, the knee, the hip, and the shoulder, right? This looks like it's including the wrist, but it's really the hip. So here's my start position. Here's my end position. I see knee flexion, hip flexion, and shoulder flexion, okay? Now the difference here is that the body, you look at his elevation, you look at his head and his shoulders, it's lower than his starting position, which means that he was going in the same direction of gravity, meaning that although I see dorsiflexion, knee flexion, hip flexion, those muscles, those dorsiflexors, knee flexors, hip flexors were not needed to bring me down. Gravity was pulling on the body mass all fine. I didn't need any extra help, which means that I had something in opposition active during that time. So although I see the joint action of ankle dorsiflexion, knee flexion, hip flexion, it's actually the hip extensors, knee extensors, and ankle plantar flexors that are working to slow me down. And it's the exact same muscles that if I say this is my starting position, this is my end position, it would be the exact same muscles that would bring you out of that position. Now the shoulder is a different story. Here the arm is down by the side, and in the bottom position, the arm is out in front of him. So in this, when I was looking at this segment, this limb, this movement from here to there, I was overcoming gravity. My arm was going out, so shoulder flexion was happening concentrically. So I was getting an eccentric activity of the lower extremities while I was getting a concentric activity of the upper extremity. So I see shoulder flexion. my hand is moving up against gravity. That shoulder flexion was caused by the shoulder flexors. So the joint action would be shoulder flexion, and the muscle activity would be shoulder flexors. Here, the joint action is hip flexion, knee flexion, ankle dorsiflexion, and the muscle activity is the plantar flexors, knee extensors, hip extensors. If I move to the frontal plane, I see the same thing. I have my arm coming out to the side. Here's my starting position. Here's my end position, starting position, end position. Here I'm in a neutral position. And here I'm moving away from midline, right? So this is plantar humeral or shoulder abduction and hip abduction. Gravity is trying to pull my legs down to the ground. Here I'm going out to the side. So overcoming gravity, shoulder abduction, hip abduction done by the shoulder abductors, hip abductors. Down here, a little tricky with this, our midline. I don't have a screen markup tool, but maybe I do. Let me see real quick. Okay, I don't have a screen markup tool, but let's go back to the screen there. All right, so what I wanted to do is I wanted to draw a straight line right here so you can see midline. So here, looking at the trunk, she's doing lateral flexion away from midline, okay? Now, if I were to measure her height right here and measure her height from her starting position, which is anatomical, we would say that she got shorter, right? Or closer to the ground. So this activity, anytime you start from stand up and you either bend forward or bend backwards or bend to the side, you're at the highest point possible when you're standing straight up. And as I start to teeter to one side bend to the left, right, forward, or back, I'm going in the same direction gravity wants to pull me, which is towards the ground. So here she's going right side bend, right lateral flexion. This is going in the same direction gravity is pulling her. This is right lateral flexion. This is an eccentric activity. It would be the left lateral flexors that are working there. Arm up to the side. I can either say that's shoulder flexion, to get my arm up here, or I brought it to the side, shoulder abduction, and she's clearly doing abduction. And then here with the right shoulder, she had to reach back behind her to put her arm behind her. So extension, or because it's mostly, we're looking at frontal plane activity here, this would be adduction of the shoulder, right? Because it's crossing midline. But the way that I have it set up in Blackboard, you can answer either or, shoulder flexion or abduction to get the arm overhead. And arm down by the side is either extension or, since it's crossing midline, adduction. But the one that there's really no interpretation for, this is right lateral flexion or lateral flexion of the trunk / spine, right? And I have it set up, and there's a syntax there, whether it says flexion or, lateral flexion of the trunk or lateral flexion of the spine. As long as those words are there, you're going to get credit for it. I will go through and make sure that there's no spelling errors or anything there. But really the big picture, the big concept here is being able to delineate between the joint action and the muscle activity. And it's not always the same. It's only the same during concentric or isometric activity, right? The joint action and the muscle activity are going to be identical. During eccentric activity, the joint action that you see, so here in this case, elbow extension, it's going to be done by the elbow flexors, right? The opposite of that. So hopefully that clears that up. I'm sure there's still going to be some questions, some confusion on that. I will reinforce that this concept is the most complex concept that you'll have to get. I mean, there's even people that have graduated kinesiology programs and even PT school and still wrestle with this, is that it's not always the joint action that, kind of understanding eccentric function. And there's the problem with that is that a reason that is because we learn everything from this anatomical position, right? From this and everything from here is concentric without really appreciating eccentric function in real life, in functional anatomy, in exercise and sport. 50 to 60% of muscle activity is based on their eccentric function, not on its concentric function. So it's an important concept to understand and to at least get your brain wrapped around. So hopefully that helps kind of going through that. You do have 2 attempts on the on the movement assessment. I know some of you jumped in and prematurely did the second attempt. I will go through and reset that. This isn't due until not this Thursday, but the following Thursday, so February the 10th. So you'll have time to go through and kind of do that. It's more important. I'm more interested in you understanding the right aspect than just getting the points. So make sure you understand those concepts, because if you don't, you are going to have a hard time on this exam. So if you don't have those concepts down going into it, definitely reach out to me and see if we can set something up. All right, hope this helps. Take care.